Hi friends, today we are discussing on the tips and tricks part 9. If you want to get the previous section, go through the channel Pharmamitra. Today we are going to discuss on three sessions that are important for the competitive exam. First one on the pharmacognosy subject, second on inorganic chemistry, and third on a small introduction in one of the topic in pharmaceutics. So all the best, each and every slides are crispy notes for you. Maintain these notes for your preparation that will help you. So can start. First of all, in pharmacognosy, today we are discussing on the general chemical test. In all our competitive exam, you may come across the chemical test. What is the color or which this type of test come under or carried out for which category of that is whether for alkaloid, glycoside, volatile oil, etc. So you may get confused during the competitive exam. So make crispy notes for each and everyone and find out some ways to study. First of all, what are the general chemical tests for alkaloid? You may come into mind that when asked for alkaloid, Dragon-Drops test is for alkaloid, and Dragon-Drop reagent is potassium bismuth iodide, and we have find out that there are five tests for the chemical test that is for carried out for the alkaloid, that is Dragon-Drop reagent, Mayer's, Wager's, and Hager's test. These are the four tests that are repeatedly asked for the exam. So note that these are for alkaloid as we already studied in our pharmacology subject. So maintain this concept in your mind and start preparation. First of all, Dragon-Drop reagent, it is related to the reagent constitution potassium bismuth iodide. It will produce a reddish brown color. You may get confused what is the content of Dragon-Drop and Mayer's. So note that Dragon-Drop and Mayer's related to alkaloid, but Mayer's we can find out, remember M for Mayer. So instead of bismuth iodide, M is the in the Mayer's reagent first letter. So it's contain potassium mercuric iodide. So Mayer's reagent is potassium mercuric iodide, which will give a green color. So likewise, you have to maintain some tricks to know what is Dragon-Drop, what is Mayer's, Wagner's, Hager's, etc. When you heard these words, you can find out what is Dragon-Drop, Mayer's, Wagner's, Hager's. So note that these types of words are related to alkaloid. So what is Wagner's reagent? It is also a iodine in potassium iodide. It also give reddish brown precipitate like what first one is Dragon-Drop reagent. Hager's reagent, picric acid is a content which will produce an yellow precipitate. And finally, the test for alkaloid is tannic acid. That is, with tannic acid, alkaloid will give a buff colored precipitate. Next is chemical text for the anthraquinone glycoside. Anthraquinone. So the test related are intra, that is like bond trackers, modified bond trackers test is the. So note that this RNTRA that we can find out in the anthraquinone glycoside as well as the drift. That is not that RNTRA is the. So the anthraquinone glycoside test is bond trackers test and modified bond trackers test. The difference is that the bond tracker test is carried out for O-glycoside. Here the procedure is that no need to know the procedure, but the thing you want to keep in mind for the clinical test are what are the test is for and what are the color change. Mostly the name of the test is asked if it is for anthraquinone glycoside or to for cardiac glycoside. So prepare like that. The difference between Bontrager's test and modified Bontrager's test is that the result is done for distinguishing the different type of glycoside available. So Bontrager's test is done to detect the O glycoside and modified Bontrager's test is done to detect C glycoside. In both the procedure, the drug is distilled in 1 ml sulfuric acid. This mixture is boiled, filtrate, then mixed with chloroform. We can find out the color change in the chloroform layer. Then chloroform layer mixed with ammonia which will give a rose pink color if any or glycoside are present in the mixture. Second is the modified Bontrager's test as we already discussed. It is done to detect whether C glycoside present. The procedure the same, but difference is that the drug is mixed with sulfuric acid and ferric chloride. The and remaining procedures are same. The final color change is pink color the same. In addition to sulfuric acid, here we are using a ferric chloride that will help us to detect the presence of C glycoside. Next is the chemical test for the cardiac glycoside. This is also asked. The important one is the Keller-Kilani test. The Keddar's test is also done. It gives a purple color which confirms the presence of cardiac glycoside. Whereas in Keller-Kilani test we can find out only for those having a digitoxos sugar moiety. That is just I am telling the procedure. In case of Keller-Kilani test, the drug is extracted with chloroform first, then 0.4 ml acetic acid is added, then along with ferric chloride. After adding the sulfuric acid, the color change happens. If after adding sulfuric acid we get a bluish color at the acid layer, we can tell that it is the presence of digitoxos, that is in case of digitalis. If it acquires a red color, it shows the digitoxos sugar present in squill. So we can find out if whether digitalis or squill is the next test is Raymond test. That is not but it's important. It gives a wild color with the presence of cardiac glycoside. Legals and Baldi tests are important. This test is performed by adding the pyridine and alkaline sodium nitroprusside. Here we can find out a red color. Whereas in Baljet test, the reagent is picric acid and sodium picrate. Here we can find out an orange color. This all show the presence of cardiac glycoside. Come to the chemical test of cyanogenetic glycoside. The two are the sodium picrate test and mercuric acetate test. Here, first in we are adding a sulfuric acid and addition of sodium picrate. The reagent will show a red color in the presence of cyanogenetic glycoside. In mercuric acetate, after the drug is mixed with mercuric acetate, we can find out a layer is separating and this will confirm the presence of the cyanogenetic glycoside. Next is chemical test for steroid and terpenoid. Not these two, the Lieberman-Burchardt test and Salvosky test. In the first, we are adding the drug mixed with acetic anhydride. To this mixture, we are adding sulfuric acid. This will form two layers with browning at the junction. An upper layer, which will can find out a green color, represent the steroid. Lower layer represent the terpenoid, red color. In Salvosky also, we can find out two layers are there when mixed with sulfuric acid. Upper layer is of steroid, which are red in color, and lower layer is yellow colored, represent triterpenes. So we are moving to the inorganic chemistry. If you are go across more cognosy and chemical sectors, you may get confused. The remaining portion we'll discuss in the coming session. So in inorganic chemistry, today we are dealing with two topics: topical, protective, and adsorbent. Not this topic as for competitive exam and for the vital purpose. Topical protective and adsorbent used examples are first of all silicone polymer or silicon oil. It may be of mainly in two types. First one, dimethicone and simethicone. You may get confused. Dimethicone means dimethyl polysiloxane. It is used as protective. And simethicone, in addition, it is the activated dimethicone form. The this Si is due to the presence of silicon dioxide. So, simethicone is the activated dimethicone with silicon dioxide. It is also used as protective, it is used as antiflagellant in antacid preparations and in deforming agent. Next question that may ask in our competitive exam: what is purified talc? It is a softness mineral that is available on Earth. Hydrated magnesium silicate is that. It is also, in addition to that, protective adsorbent. It is used as a dusting powder, infiltrate media, glycan and absorbent in tablet manufacturing, as we know. The next is titanium dioxide, that is TiO2. It is all used as opacifier, topical protective that protect the skin. In addition to that, we know the calamine also having a protective action. It is simply the constituent is zinc oxide and 0.5% ferric oxide. It will act as a mild astringent, antiseptic, protective, and will give a soothing effect if any eczema is there. The difference in calamine lotion is that in lotion, in addition to the content, it includes the calamine, zinc oxide, bentonite, sodium citrate, liquid phenol, glycerin, rose water, etc. It also having the mild astringent, antiseptic, and protective action. The zinc compound paste is simply the zinc paste. If we find out a question like Gunas paste is consisting having the zinc oxide content. This will use as a dressing for the varicose ulcer. Yeah, moving into the next category, topical antimicrobial agent. In all category, number of agents are there. What important for the exams are discussing here. First of all, hydrogen peroxide. You may get number of options for hydrogen peroxide like antimicrobial agent, strong oxidizing agent, bleaching, antiseptic, and germicide action. This hydrogen peroxide, which will act as a strong oxidizing agent, by liberating the nascent oxygen. Second topical antimicrobial agent is important, that is chlorinated lime or bleaching powder or chlorine powder, and its equation is COClCl. And calcium hypochlorite, it is also act as an antimicrobial agent, disinfecting and bleaching agent. Among the topical antimicrobial agent, the very important portion is the iodine solution concentrations and its term. You may get confused in the exam. First one, aqueous iodine solution, or its name as Lugol solution. Its content is 5% iodine and 10% potassium iodide. This iodine and potassium iodide percentage varies in different types of iodine solution available. And it is a source of iodine oil and which will act as a germicide and fungicide. Second solution form is weak iodine solution. It is known as iodine tincture. Weak, so its concentration is no. So we can find out or categorize or can connect with its iodine content is less. So it is called as iodine tincture. Here only 2% weight by volume of iodine is there and 2.5% potassium iodide with 50% alcohol. Same as iodine, and but it produce irritation on cuts or wounds. The next iodine solution is the strong iodine solution. As the word strong, so the percentage of iodine get increased to contains 10% weight by volume of iodine and 6% weight by volume of potassium iodide. It also acts as antiseptic. Povidone iodine solution. Povidone, it is a complex formed by the interaction of iodine with the povidone. Povidone is polyvinyl pyrrolidine. It is act as disinfectant and as well as antiseptic. Next antimicrobial use is potassium permanganate, otherwise known as County crystal, and it is used as antiseptic, disinfectant, strong oxidizing agent used for water treatment. If you ask for County crystal, it is simply potassium permanganate. The next is titanium dioxide, that is TiO2. It is all used as opacifier, topical protective that protect the skin. In addition to that, we know the calamine also having a protective action. It is simply the constituent is zinc oxide and 0.5% ferric oxide. It will act as a mild astringent, antiseptic, protective, and will give a soothing effect if any eczema is there. Or cinnabar. Cinnabar related to mercuric sulfide. It is a salt of mercury which will act as pharmaceutical aid as well as astringent. Another category is alum, that is not the equation potassium aluminum sulfate with 12 molecules of water, which will act as astringent, antiseptic, and pharmaceutical aid. Other examples for anti-dandruff preparation or anti-seborrheic preparation include the most important anti-dandruff preparation is selenium sulfide, and it, it is its concentration, that is 1 to 2.5 percentage, is used as anti-seborrheic in shampoos, whereas the other category, that example is cadmium sulfide, will act as fungistatic and anti-seborrheic. Anti-seborrheic means this will relieve the symptoms of seborrhea, that is to break up the oil and remove the flakes, that is seborrheic means. Which will normally the anti-seborrheic preparation will include the selenium sulfide, the cadmium sulfide, etc., which will remove the excess oil and break up the oils and flakes that is present in our hair. Yeah, moving into the next category, topical antimicrobial agent. In all category, number of agents are there. What important for the exams are discussing here. First of all, hydrogen peroxide. You may get number of options for hydrogen peroxide like antimicrobial agent, strong oxidizing agent, bleaching, antiseptic, and germicide action. This hydrogen peroxide, which will act as a strong oxidizing agent by liberating the nascent oxygen. Second topical antimicrobial agent is important, that is chlorinated lime or bleaching powder or chlorine powder, and its equation is COClCl. And calcium hypochlorite, it is also act as an antimicrobial agent, disinfecting and bleaching agent. These terms expressed in this slide are related to parenteral. First one, positive pressure. That is, we come across in the parenteral that the positive pressure, negative pressure is that. Positive pressure is normally found in aseptic and sterile area. We come across class 10, class 100, 1000, etc. That is, positive pressure is mainly seen in class 100 area. The aseptic process validation method here we use is sterile media field or broth field. HVAC, that's a term we can see in parenteral. HVAC means heating, ventilation, and air conditioning. The next is titanium dioxide, that is TiO2. It is all used as opacifier, topical protective that protect the skin. In addition to that, we know the calamine also having a protective action. It is simply the constituent is zinc oxide and 0.5% ferric oxide. It will act as a mild astringent, antiseptic, protective, and will give a soothing effect if any eczema is there. Come to the chemical test of cyanogentic glycoside. The two are the sodium picrate test and mercuric acetate test. Here, we are adding a sulfuric acid and addition of sodium picrate. The reagent will show a red color in the presence of cyanogentic glycoside. In mercuric acetate, next is pyrogen test. This test is very important. It is otherwise known as LAL test, limulus amoebocyte lysate test, and this is detected by making the test or making the analysis on fever response in rabbit. That is 3 in number. If pyrogens are present, the body will show a body temperature rises. This is based on gelling of the pyrogenic preparation. The sterility test method used in parenterals are membrane filtration as well as direct inoculation method. By this, we come to the end of the session. The remaining important portions in parenterals are there and many subjects are there. We can discuss in the coming session. If you find this video useful, please share, support, and if you are not subscribed till now, please subscribe. Thank you for watching. Thank you once again.